Hi doctor, how are you?
Hi, I'm fine, thank you.
Okay, let's start with the first question, okay? Could you explain what cervical cancer is in simple terms, how it developed, and why it's remained an important women's health issue today?
So cervical cancer is a cancer of neck of the womb, and it is the third highest cancer in females among Malaysia. And it usually rises around 30 years old and then peaks at 50 to 65 years old among women. And its cause mainly is HPV persistent infection. And if it's detected early, it can be preventable and also treated accordingly.
Okay, doctor, next question. Who is most at risk of developing cervical cancer and what are the main causes?
Smoking, multiple sexual partner, immunocompromised patients such as patients who is on long-term steroid, or history of abnormal pap smear, patient with infections such as HIV, they are very high risk. And then another main cause of cervical cancer actually persistent HPV infection. So we have high-risk HPV virus and also low-risk HPV virus, but then persistent high-risk HPV virus, which is the main cause of cervical cancer. So once you have a HPV infection, usually it can go off by itself. But then if it's persistent infection, then you will have abnormal cervical smears on pap smear, and then subsequently it can develop into cervical cancer.
Okay, now we talk about symptom and warning sign. One challenge with cervical cancer is that it can be silent early on. And what symptom or warning signs should women be aware of, especially in the later stages?
Yeah, you are right. Cervical cancer can be very silent, and most of the patients does not have any symptoms until it becomes late stage. So what are the symptoms that you have to be aware of is actually abnormal bleeding. Any kind of abnormal bleeding like prolonged menses, heavy menses, intermenstrual bleeding, and then abnormal vaginal discharge. So any pelvic pain, which is unscheduled pelvic pain, which you don't know what is the cause, actually you have to go and check, because most of the early cervical cancers there are no symptoms.
Doctor, at what point women should seek medical advice and when should they start considering cervical cancer screening?
Okay, so whichever symptom that I mentioned before, so when patient aware of all the symptoms, of course they have to come and check. But other than that, regular screening is important. So any patients or any females who is age 30 and above who is sexually active are advised to do pap smear and HPV screening test.
Okay, now we're moving on to the laboratory perspective. What screening or diagnostic tests are recommended today, such as pap smear, liquid-based cytology, HPV testing, or co-testing, and how do they differ?
Okay, so we have few kind of tests. First is conventional pap smear, then liquid-based cytology, and also HPV testing. And then we call it co-testing because we do pap smear and HPV in the same setting. Okay, conventional pap smear is the traditional one. So we use slides to prepare the smear and then send to the lab. Liquid-based cytology is the more latest one and then more accurate and slightly higher accuracy compared to conventional pap smear. So we are moving forward towards liquid-based cytology. And another plus on liquid-based cytology is advantages is you can do HPV testing at the same sample, so you need not require two different samples. And HPV test also can be done by self-sampling, which is more convenient to the patient and more easy, and easily can convince patient to come for testing actually. So what is the benefit of HPV co-testing is actually because once your HPV is negative, your risk of cancer is very, very low. So you no need to do regular pap smear yearly or 3 yearly. So once your HPV is negative, you can do 5 yearly screening without a pap smear. So that actually makes things very easy. Once your HPV is positive, then you have to do a pap smear to make sure there is no abnormal cells. Then once your pap smear is negative, then you can go for 3 yearly pap smear. So this is how actually we segregate our patients and who require more frequent screening and not.
I see. Okay, before we wrap up, what key message would like the public, especially women, to remember about cervical cancer prevention, early detection, and taking charge of their health?
So awareness of cervical cancer is very important among females because it's a very silent and slow progressing cancer. So once you have HPV infection, it takes almost 10 to 15 years to get cervical cancer. So that is where the screening of HPV and pap smear comes in, to detect early and to prevent cervical cancer. So also we have seen patients, I have seen patients who like around 60 years old doing the first time pap smear, suddenly they get abnormal smears, and then we go for colposcopy because with HPV positive and pap smear abnormal, you'll require a colposcopy, and then noted to have cervical cancer. Without any symptom, patient is fit, well and all. So it's too late to do a pap smear at 60 years old. So start early and then to prevent early and to treat the cervical cancer early.
That's all for today. Thank you, Dr. Gaya,
No problem.
for helping us understand cervical health, HPV testing and preventive care. If you are listening, remember that early detection is key. Don't skip your screening. Stay safe and see you in the next episode.